How do hearing tests work and what do they show? Have you ever wondered how hearing tests actually work and what they reveal about your hearing health? Hearing tests are essential tools that help evaluate how well your ears and auditory system detect and process sounds. They can identify the presence, type, and severity of hearing loss, which is crucial for maintaining ear health and awareness. The most common type of hearing test is called pure tone audiometry. During this test, you will wear headphones and listen to a series of tones at different pitches, ranging from low to high frequencies, typically between 250 to 1000 Hz. You will indicate when you hear a tone, and the softest sound you can detect at each frequency is recorded as your hearing threshold in decibels. These thresholds are then plotted on a graph known as an audiogram, which visually represents your hearing sensitivity across different frequencies for each ear. This test assesses the entire hearing pathway, from the outer ear through the middle ear to the inner ear and auditory nerve. Another method is bone conduction testing. In this test, a small vibrator is placed behind your ear on the mastoid bone. It sends vibrations directly to the inner ear, bypassing the outer and middle ear. By comparing the results from air conduction and bone conduction, audiologists can determine whether hearing loss is due to issues in the middle or outer ear, known as conductive loss, or if it originates from the inner ear or auditory nerve, referred to as sensory neural loss. Speech tests are also an important part of hearing evaluations. These tests measure your ability to hear and understand spoken words at various volumes. They often use lists of one-syllable words. The speech reception threshold identifies the lowest volume at which you can correctly repeat 50% of the words, while speech discrimination scores assess how well you understand speech at comfortable loudness levels. These tests give valuable insight into how hearing loss can affect communication. Tympanometry is another test that evaluates middle ear function. It measures how your eardrum moves in response to changes in air pressure. A small device pumps air into your ear canal and records the movement of your eardrum on a graph called a tympanogram. Abnormal results can indicate issues such as fluid in the middle ear, a perforated eardrum, or problems with the bones in the middle ear. Otoacoustic emissions testing checks the function of tiny hair cells in the cochlea, which is part of the inner ear. A small probe is placed in your ear to emit sounds and measure the faint sounds that the cochlea produces in response. If these emissions are absent or reduced, it suggests damage to the hair cells, indicating sensory neural hearing loss. Lastly, auditory brainstem response testing records electrical activity along the auditory nerve and brainstem in response to sounds. This test uses electrodes placed on the head and does not requiring active responses from the patient. It is particularly useful for infants, young children, or individuals who cannot complete standard hearing tests. This test helps assess neural pathways and can detect hearing loss or neurological issues affecting hearing. Together, these tests provide a comprehensive picture of your hearing health. They help identify whether hearing loss is present, its type, severity, and potential causes. This information is essential for guiding appropriate treatment, which may include medical management, hearing aids, or other interventions. Regular hearing checkups are vital for maintaining ear health and detecting hearing loss early. They help preserve communication abilities and ensure that any issues can be addressed promptly. Hearing tests are safe, painless, and do not requiring special preparation. If you notice any difficulties with your hearing, it is important to seek a professional evaluation from an audiologist or healthcare provider to ensure accurate diagnosis and care.